When I started to work, I was really touched by the difficulties the persons with disabilities were facing, and I tried my level best to serve the population. I'm Deepak Sapkota from Karuna Foundation, Nepal. What exactly we do is, we work together with community to build a local system that is capable enough to prevent childhood disability and also give opportunity to the children with disabilities and their families to have a dignified life. From the very beginning, when we started our program, Karuna believed in development in an entrepreneurial way. We are giving all the support to the existing structures that prevails in the village. So, we strongly collaborating with government systems and semi-government system in the villages like village development committees or municipalities, so that one day when Karuna will leave, the program still will continue. We have two unique programs within Karuna. One is called Share and Care, that comprises of health insurance, community-based health insurance, and other one later on we developed after learning from Share and Care is Inspire2Care, which is specialized on prevention of disabilities and also community-based rehabilitation. In Inspire2Care, what basically we do is, like after assessing the local situations, we focus much on individual child or adults with disabilities and their families, so that we can identify what exactly are in need according to the CVR guidelines. So we make an assessment of every individual and make needful intervention plan for a couple of years. In terms of prevention of disabilities, we are very much focusing on maternal-child health. For example, to register all these pregnant women in the village, and we also make a very clear delivery plan. The second part of this Inspire2Care is to make screening in early childhood development centers and then primary schools. We give lots of focus on health management system and the disability management system in the village by training a professional person called community-based rehabilitation worker or facilitator, who is the backbone of the program. So this person is selected from the community, and he or she is well trained on the issue and considered as a leader to lead the program in the longer run when there will be no Karuna, because we are external partners. We work for first 3 years with our financial support and technical support to build the capacity to teach, to give the skill and knowledge to the local people, including this CVR facilitator, but also to incorporate the plan in their annual plan and allocate money from their own fund, and then try to mobilize all the possible resources that exist within their own reach. And in the last 2 years, we try to observe them from little distance, that things can happen independently without having external partner. That is giving us a solid basis for sustainability of the program. After having this Inspire2Care or even the Share and Care in the villages, we started to see lots of changes, specifically in the life of the person with disability, and more importantly in the life of the family. Before that identification, the child or the person was living like a very like a commodity, not like a human being. But once you started to get this kind of recognition or entitlement from the program, the identity had changed. People consider you quite important. When people started to participate into the day-to-day life, into the social life, people are slowly changing their opinion and thoughts and attitudes toward this population, and then they are giving lots of attention. And then we are quite happy to see that even in some cases these persons are making their own income. This is, I think, one of the best approach, I would say, in dealing with disabilities, that they need to grow in a full potential.